I pledge allegiance to the flag of the United States of America and to the republic which stands one nation under God, indivisible, liberty and justice for all.
Mr. Chair, he did say the 4th, it is the 14th.
I'm sorry, December 14th. Excuse me. All right. For a roll call.
Commissioner Matthew, Commissioner Hoffmaster,
Here.
Commissioner House,
Here.
Commissioner Leininger,
Here.
Commissioner Baker,
Here.
Commissioner Lanius.
Here.
Thank you.
All right, we have 5 members present, 1 absent. We'll move on to the approval of the agenda, and I am going to propose some changes to the agenda underneath new business. If you will follow along. I believe wage increase should be item C. We have A, environmental health fee, B, Board of Health meeting schedule. I'm going to insert D, new employees or new positions. I believe that's a separate item that we need to vote on and discuss individually. Then we're going to go to E, environmental health supervisor wage. After those items are discussed, then I think we can go to F, budget amendment. Those things will have an impact, or the decision that we make on those items will have an impact as to where we need to go with the budget. After F, budget amendment, we're going to go with G, Board of Health bylaws. And then H, the intergovernmental agreement, because those 2 items are kind of tied together. And then I, the advisory committee bylaws.
It's like an alphabetic soup.
Yeah, it is.
Just know where we're at.
We'll get there. We will. And with those changes, I will entertain a motion to approve the agenda as amended.
I'm gonna approve whatever you just said.
We have a motion from Commissioner House to. Haven't had my full cup of coffee this morning. Motion from Commissioner House, second from Commissioner Lanius to approve the agenda as amended. Any further discussion? Hearing none, all those in favor say aye. Aye. All those opposed, motion carried. Approval of the minutes of the November 9th, 2023 Board of Health meeting.
Already approved it.
You move to approve them?
I support.
We have a motion by Commissioner House, second by Commissioner Hoffmaster to approve the November 9th, 2023 Board of Health meeting minutes. Any discussion? Hearing none, all those in favor say aye.
Aye.
All those opposed, motion carried. Public comment, that time of our meeting where we have 2 times for the public to come and address the board. Do we have Ashley Ellsworth from the HLS Bureau, but we'll maybe let her talk with Laura later on, or? All right. Health officers report. Let's start on page 6 of our packet.
Good morning.
Good morning.
All right, so just to run through the highlights here, the CDC infrastructure grant, we're thinking about this, wanted to give an update on some of the progress on the projects. We have completed the water bottle filter heating water station in 3 Rivers and also now in Hillsdale as well. I have a contractor, the same one that did the work in 3 Rivers, come to the cold water office today to review what's here and provide a bid for that. Once I have that, I'll be talking with Scott Walls from the county and sharing that with him, and hopefully he makes it actually today when the contractor is here. So I do have 2 bids for painting from local painting contractors in the Hillsdale area for painting the Hillsdale building, and I have a bid for carpet from our Hillsdale Hillsdale County local carpet shop. So those will be brought forward to the Finance Committee in January. So coming soon. The local funding has been taken up at Hillsdale and St. Joseph County, and both counties denied our request for an increase. And the budget amendment that is before the board today does not include any increase in appropriations. So I've also been talking about a staffing and wage plan based on an increase in ELPHS funding that the agency received. This was a plan that was developed with the directors, accountant, used information from accreditation reports and a time study done by our personal health and disease prevention staff, as well as being shared with the finance committee, all of that information. The plan considers the additional state funding, the majority of which came in for environmental health programs, and plans for use of designated funding, primarily Medicaid cost-based reimbursement. Finance committee did vote to bring the proposal forward today. That's why it's in your packet. One of those proposals includes an increase in staff wages, and we've been talking a lot about staff wages here. The compensation study that the agency paid for in 2019, we finally made it to the recommended 2019 level last year. It doesn't take into account inflation, however, and a recent Michigan public health compensation study conducted for another district health department in the state demonstrates that the wages for the staff here are significantly low, and in many positions, the lowest in the state. So, or at least those that apply or responded to the survey. So, our directors and supervisors already anecdotally know that our wages are low because as qualified candidates leave us, they leave us year for an increased wage, and it's hard to find candidates that are qualified for open positions. So as I outlined in my report to the Finance Committee, the staffing plan includes new positions, 2 positions in environmental health, an environmental health supervisor with oversight of drinking water and on-site sewage programs, and an environmental health sanitarian. Majority of funding, as I mentioned before, did come through to EH programs. During our accreditation review this spring, it was noted that we do not provide the recommended number of FTEs in the food program or full-time equivalents. It was also recommended during that review that we add a supervisor position with oversight of general programs, which would be water and sewage. These recommendations were of no surprise to me. Over the past 15 years, the agency has downsized our EH team, going from 3 coordinators in 2006 to 1 coordinator today, reducing EH sanitarians with 1 layoff in 2009. Not replacing positions as staff retired or left often, not always. Proposal also includes an additional 1.5 FTEs in nursing that would focus on communicable disease, sexually transmitted infection, and immunization programs. Personal health and disease prevention staff need additional staff hours to meet minimum requirements for investigating cases of disease within the district. And finally, adding a human resource professional or support person for our administrative services team. This individual will be tasked with reviewing, upgrading, and implementing the agency's onboarding process, working with all staffing concerns and issues. Currently, the agency's administrative services director is tasked with those duties, in addition to all of the financial aspects which come about after a downsizing of directors that happened in 2017, when, as a new health officer with financial concerns here, I reorganized public health from 5 down to 3 directors. The work and admin services requires more work hours than one can provide. All right, so we'll be talking, I guess, more about that as we get to new business. Our health education and promotion supervisor, Alex, who's with us today, has notified me that he is leaving the agency. His last day is Friday. We want to wish him well. He has accepted, this is from Lifeway, so he's not leaving us to go too far away. And some of you in Hillsdale County may have some contact with him still, so that's good. Also notified by St. Joseph County Administrator Teresa Doring that the county is not really ready to make decisions on how to use the opioid funding that they're receiving. She's planning to form a steering committee or task force after the first of the year. to look at how to best utilize, that, source of revenue. So I'm pulling back for fiscal year 24 at this point on opioid work. That's my intention. And we will look at this again for FY 25. The kindergarten oral health assessment, the governor signed a few bills yesterday, one of which was Senate Bill 280. This is a bill that provides a screening for children entering kindergarten or first grade of a dental oral health assessment. Many kids get this already, but there are a lot of kids that don't. And for those children that are not receiving that kind of dental screening, this bill would provide local health departments, either directly or through contract, the opportunity to provide that assessment. So there is funding that is available to Branch Hillsdale St. Joe for 24, and it can be used in the form of a planning grant. I think we're going to head that direction. There's a few concerns that have come up since I typed this report up, but I do want to take a look at this program, the cost of it, if we can contract with another entity to provide the services that would be necessary, and what really the bottom line is financially for the health department. So, but with the signing of this bill, not really sure that we're going to be able to continue to say no, which is what I've been doing for the past 2 years. So, not really anything new with Hillsdale Hospital and mobile van. Public health concerns, just wanted to mention the Get Ahead of Lead statewide strategy that MDHHS recently put out there. The focus is really to get ahead of it, in other words, get ahead of lead, but we're very responsive right now. So right now, you know, the lead amounts in drinking water, for example, have gone down. And Three Rivers is a great example of this. So everything was fine with drinking water in Three Rivers until they changed the regulation as far as how you sample and the numbers that you're looking for. Suddenly, Three Rivers had a problem. They've never had a problem before. Did they have lead service lines? Yes, they did. But until the regulations were changed, there wasn't a problem. So there are other communities like Three Rivers that may have similar situations occur, right? They don't have treatment, for example, but provide that corrosion protection to the lead service lines, for example. So this is intended to encourage families to, if you have young children, somebody in the home that might be pregnant, look at your fixtures. Are they before 2014? Well, they probably have lead containing parts within them, and you may want to change them out, or put a filter on your main drinking water faucet in the home so that you can ensure that everyone is not getting doses of lead with every drink of water. So that's really kind of the purpose of Get Ahead of Lead. Lead is still more of a concern in old housing stock and lead paint and the dust that comes from that. We don't want to lose sight of that, and we are not losing sight of that in public health. But this water stuff, because the regulations are changing, are causing us to use the strategy of the state. Okay, enough said about that. Not too late to get vaccinated for seasonal respiratory diseases like flu, RSV, and COVID. State is just starting to see some increases in flu cases. I see that every year. Rabies and domesticated skunks, you may have seen a press release about this. There is a breeder over in Macomb County that apparently breeds these animals and sells them as pets.
Skunks?
Skunks. And apparently there was some mixing of wild with domesticated animals, some rabies transmission. One of the animals actually that have rabies. So we tried to get the word out there. If you chose to make a skunk your pet,
Did you say this is Hillsdale County?
No.
No.
They did.
Three Rivers.
They wouldn't survive it.
Who knows where these could come from, right? But yeah. So we just want people to know.
Learn something.
If you choose to make that animal your pet, you need to really, make sure that rabies is a concern for you.
I have a raccoon, and a skunk. Kid.
You did?
Told you, Bronson.
All right, so also on the agenda later today, the environmental health supervisor position. We offered that internally. Paul has done some interviews. We haven't made an offer yet, but the staff, one of the staff member, the only staff member that's expressed interest in the position, has indicated some concern with regards to our personnel policies and how the adjustment would be with regards to his rate of pay. And I'm just gonna leave it at that for now because it's coming up later. Nothing really new to report here in our Coldwater office. Hillsdale, nothing new on that, elevator yet. And I've already talked about what's going on in Trooper, so I think that's it for me.
Any questions for the health officer?
The opioid part, with what you brought up with Teresa, so I think she's doing a good job of trying to figure out the best way of using those funds, and the health department obviously will be a big part of that, so we'll figure it out, but
Yeah, she's just not ready, and that's
Yeah.
okay. You know, everybody's in a different spot.
Well, you know, and we all have to make sure that whatever we do with those opioid funds comply with the
Yeah.
Mhm.
strings that are.
court ordered, you know, settlement agreement, you know, through those bankruptcy proceedings and those class action lawsuits.
Mhm.
And, you know, Dulce County has approved that 10,000. It's still there. Understand the health agency is not gonna ask it. And the kindergarten oral health assessment. How much funding is the state providing for that?
63,000-ish.
And your estimated cost to
I
implement
haven't
that?
done that yet. That's why I was hoping to maybe take the planning grant, so we could figure some of that out and get some money to do it. I don't think there's anywhere near enough money there. I'm sure there's, sure of it. But, I have not put any time into what would this actually cost. There is a company that's reached out called Smiles on Wheels, to me, who would like to take the program on. We would do a contract if we went with someone like that. They are currently doing the kindergarten oral health program in Jackson County.
They come to our district as well.
Yeah, they kind of are all over the 3-county area. So there is a provider that's interested. They've reached out to me, but we haven't put any time or effort into investigating it because right now we haven't agreed to accept funds.
Any other questions? If not, moving on. Thank you, Rebecca. Dr. Luparello,
Hey, good morning.
good morning.
Well, of all the memos we had to send out, the skunk one was by far the most interesting to me, so I automatically emailed Rebecca and said, who has a pet skunk? Well,
Now we
evidently
know.
people do,
Now
so
we
now
know.
I know.
And explain
And,
a lot.
and there's a guy that picks up, so I'd hate to know who gets the job of removing the scent gland on all of those.
That was before the
Really
most
don't
interesting.
sneak where they don't spray.
Good advice, thank you.
You had something-
We have something in our neighborhood.
That worked.
Clean the neighbor.
That works well for the pickleball player, right?
My neighbor hand feeds. Wow.
My medical director report is on page 9 in your packet. Not much new there, although we are going to start some meetings where I join Callie's group one Monday of the month so that there's a little more continuity between the clinic staff and myself and questions that are going on there, etc. So I think that'll be another very good thing. Turned in my paper last night, which is due on Friday, and then this capstone class will be over, and then just that one more class in the spring, and then my master's will be done. Yay! I kind of flew through that one, so that was good. And so with regard to my educational program this month, I was kind of feeling, maybe it was the holidays and stress and everything going on, but I was kind of feeling like everything that I bring here is a little bit heavy, like who should get vaccinated and what we're all going to get sick from and et cetera, et cetera. So I started picking up some stress management techniques and laughter with one of them. And very interestingly, if you look at the science, laughter does do some amazing things for our body. It kind of brings good oxygen to all of our organs. It helps with our immunity. You know, it makes other people around us happy, which then in turn helps all of their things, so all of their health. So it's a great wellness thing. So I thought, and creativity was also in there. So I thought I was going to kind of do something that was a little lighter. So in your packet, you have "'Twas the Night Before Christmas" for the Branch Hillsdale St. Joseph Agency.
Mouthful there.
A mouthful.
That's a mouthful.
The title is huge. So, 'twas the night before Christmas when all through our county, not a creature was stirring, not even a townie. The clinics were open, serving people with care in hopes that St. Nicholas soon would be there. Patients were nestled all snug in their beds while visions of health and wellness danced in their heads. And Rebecca in her sweater and Teresa in her flats had just settled down for long budget chats. When out on Marshall Road there arose such a clatter, board members sprang from their chairs to see what was the matter. Away to the window, they threw up their agendas, looking out the door and hoping for new members. The moon on the breast of the new fallen snow gave the mobile van a very bright glow. And what to their wondering eyes should appear, the staff with patience calming their fear. Alan leading his IT group so lively and quick, we knew in a moment the health department was slick. The holidays are coming and we must prepare time with friends, family, and neighbors to show that we care. When wrapped in eagles, the nursing staff came, they smiled and called others by name. Thank you, Rebecca, Teresa, Chris, Kelly, and Paul. We appreciate Laura, Alex, Josh, and it takes a great team to care for the nation, the same for Hillsdale Coldwater and St. Joe's population. COVID, the environment, PFAS, and the flu, there is so much amazing work that you do. And then in a twinkling, we got in the mail funding for projects that we knew couldn't fail. As we drew in our heads and turned around, plans for new health projects abound. Now, Mr. Leininger, Mr. Lanius, Mr. Matthew, Mr. Baker, Mr. Holt, and Mr. Hoffmaster, you all help your neighbor. From the meetings, the questions, and the telephone calls, your counties are grateful and appreciate your love. Well, this poem was fun, entertaining, and light. The true meaning of Christmas is special and bright. I'm grateful for all of the work that we do. I pray that your holidays are wonderful for you.
Nice work.
A little lighter this month. I was like, enough with the.
Very great.
Oh, it's a step up from the
So we
spot
tried.
Yeah.
So, yeah, so we kept it a little lighter. So stay tuned for January, which will probably be some heavy, some heavy disease.
Well, our expectations are here now, so
That's right.
better get something for the new year.
I think you're very right, Dr. Lucarello. You know, the holiday season for many is a very stressful and trying time. And,
Mhm.
you know, Alex is going to that agency that deals with a lot of those individuals that need help dealing with their mental health. And, you know, it's one thing we maybe don't stress enough is good mental health.
Sure. Yeah, I agree. Our resources, I'm happy to see that, Alex, because our resources certainly are stress, you know, and we see that in everything we do, right? We see that in the homeless population. We see that in people coming into our health department clinics. We see that, you know, just at the store and on the street and work every day, right? I was saying, I don't know if it's me getting older or people just not being as kind or considerate or a combination. But always heavy on my mental health when I try to go to work and I try to provide a service and you know, enjoy what I'm doing and try to bring that to people and just give information and then someone's yelling or screaming or, you know, yelling at my front desk staff or just things that are so inappropriate and just make us all feel that. So we can all use a little lighthearted some things. So I hope everybody enjoys time with friends and family and, you know, reach out to somebody that, you know, might need a little extra for the holidays. Important. So that was all I had.
That's it.
That is-
Maybe you could do a little rap.
Yeah.
I could have done a little rap, but you would not have liked that.
Well, thank you, Dr.
Thank
Lucarello.
you.
Any questions for Dr. Lucarello? If not, moving on. Ms. Sutter,
Good
your
morning.
agency on aging report.
We have a pretty brief report for you today. I also included a correspondence from the Bureau that came, of course, after. It's just Murphy's Law. It came after the report had been submitted to Teresa, but our budget amendment got approved. And so we always like to share that with the board, and certainly Chair Leininger is is noted as needing a copy, because, you know, you need more paper in your life, right?
I had got it by email
Oh,
already.
good, fantastic.
But I didn't say anything because I was gonna let you announce it.
No, I'm glad that you have it. You can certainly maybe stoke your fire. That maybe that would help in the fireplace as you're enjoying the holiday. Our services to victims of elder abuse program is soaring. We've had really interesting cases yet this month, and have worked with a few new community partners. And I received a little bit of additional feedback after we leveraged the supports of the Twin County Probation Center in Three Rivers. It was especially helpful and supportive to this person who was moving and had large pieces of furniture that, you know, is not part of our team's job duties to move furniture. So we were very grateful to have such a responsible group of people to help in this very contentious situation. And then we've also made reports to entities that we've not reported to before, including the U.S. Department, the Office of Civil Rights, the Attorney General's Office, and the Adult Foster Care Licensing Division here in Michigan. So there's a lot going on and a lot of people being mistreated. So I'm so grateful. I feel grateful every month that I report to you for this team that we have. Tony and Wendy do a fantastic job. And we look forward to another successful year. Our budget is looking good for that as well. They also submitted, they have an opportunity, all programs across the nation do, to honor, to support a certain week in April for National Crime Victims Awareness Week. So we're going to work with the probate offices that have an advocate, and then work on some activities in the community with our law enforcement friends, schools, and businesses. We'll know more later, but it's to get some stuff printed, maybe put some magnets on law enforcement vehicles to just raise the awareness that, you know, crime victims, you know, need support too during their time of tragedy and trauma. We were also notified by the division that they'll be performing a contract review in April of next year, so that'll be fun. We did well for our very first one in 2021. Some of you were with us. And so, you know, they have a pretty specific and very particular lens that they look through for gauging success and contract compliance. And so stay tuned. They may want to speak with board members. I don't know. They certainly interviewed staff. And so it'll be fun. I look forward to it every year. Well, every couple of years, I should say. We've submitted the Branch County Commission on Aging documentation in our formal request to the Bureau to have an additional congregate meal site opened in early 2024. So we're very excited and very pleased with how that is going in terms of contract performance. Certainly they're exceeding all of their contract numbers and what they targeted in their budget. But they're serving so many people, around 70 people a day in Coldwater for a congregate meal, and they have eliminated their wait list for home delivered meals in Branch County. So when you think of how quickly that happened, I really couldn't be more pleased. We do have an open, must be sort of something in the air or the water, I don't know. Our nurse care consultant is moving on, and so we have an open position. Are searching for a nurse at this time. And you know, end of the year always brings up, you know, final reports and final numbers being uploaded and transmitted in our programmatic reporting database. So we're in the sort of the process now to certify our meal counts and do a lot of, you know, scrupulous and scrutinous work. It just makes me feel very grateful for our team, grateful for our decision makers, our board members. And so on behalf of our team, we wish you all a happy, healthy holiday and peaceful holiday. So, any questions?
Any questions for
Yeah.
Commissioner Lenny?
When is your congregate meal program starting?
Well, there's an existing one here in Coldwater, that's ongoing, 3 days a week. And they want to expand that to the Union City Senior Center, and they have an agreement with the Village of Union City. Hopefully start in January. The approval process with the Bureau, is getting there. We just haven't gotten official approval quite yet. But all the ducks are in a row, so to speak, with the Commission on Aging, so.
Any other questions? Does Ashley want to speak now or later? Good morning.
Hi everyone, Ashley Ellsworth with the ACLS Bureau for the state. I just want to give a couple of updates on some budget things, budget items. You probably all know there was a continuing resolution that was issued to fund the government through February 2nd. So ACLS Bureau issued 1 month of federal and state funding that went out. I think it was the day before December 1st, but then obviously another month we'll need another month of funding, both federal and state will go out the end of this month before January 1st. I did want to highlight that the administration for community living, or ACL, indicated that Michigan's population has decreased. We know that our older adult population is increasing, but the overall population of Michigan is decreasing. Therefore, there is a slight decrease in Michigan's federal funding. So just to kind of recap, or just to give you a kind of a picture of it, in fiscal year 23, our percentage was 3.23 of the Michigan budget, federal budget, and it's decreased to 3.21 in fiscal year 24. So that's something that's on everyone's radar. I'm sure everyone's seen the reports that by, I think it's 2025, that older adults are going to outnumber those 18 and younger. So that is a concern, and it's certainly something that Scott's very tuned into right now. We had our big meeting with 4 a.m. yesterday, and that was something that he brought up that he's concerned about. So I'm sure the commission will also be interested in hearing about that. That's really all I have, though, unless there's any questions.
Any questions for Ashley?
Also want to wish everyone happy holidays. I'm going to envision little skunks with bows on
Yeah, all right.
Christmas tree Christmas morning, though. So thank you for that.
Thank you, Ashley. All right, moving on. Health education and promotion. Mr. Allen,
Morning.
your last report here to the board in this position.
So as Rebecca said, this is my last week with the agency. First off, I want to thank all of you for allowing me to come to these meetings and fit in and get this experience. Also, of course, thank you, Rebecca, for hiring me. Giving me this opportunity. I'll certainly miss, working here. But that being said, I'm not going that far. It is when I went into public health, I wanted to be behavioral health was my passion. So it's a good move for me, but like I said, I wouldn't be able to have done it without everything I learned here. So thank you. That said, I have a pretty short report, naturally, for everyone. So we had a couple different trainings that our staff was involved with during November. Callie and I did a 3-day conference in Kalamazoo for incident command system training. Super fun.
Oh yeah.
Our health educators and community health workers participated in crisis and emergency risk communication training back in November. As usual, we also did a handful of other community events. November 19th, we were at Branch County Winter Wonderland. December 6th, Michigan Works Southeast, which is in Hillsdale. They had their resource fair. December 7th was Philadelphia County Winter Festival. Then we have a couple other things coming up. One of them being December 20th, Toys for Tots at Sturgis. I believe we're trying to set up a couple of those. as well. Furthermore, we, as usual, kept up with our Facebook, Instagram topics for the month. For November, it was diabetes awareness, chronic obstructive pulmonary disease awareness, lung cancer awareness. November is a very busy month. Holiday safety, health insurance open enrollment, winter safety tips, antibiotic awareness week, food safety awareness, safe cooking tips for Thanksgiving. That's all. During the month of November, our community health worker, Rachel, welcomed 3 new clients, continues to focus on her existing clients, trying to get those cases closed out so she doesn't kind of hit the ceiling of the amount of clients she should be working with. I believe the focus for that program as a whole over the next month or so will be on the newly available Medicaid reimbursement program that will allow CHW services to apply for that reimbursement. I know we're not properly set up to make that happen yet, but we'll keep working on that. Anyways, told you all I'd keep it short. That's all I got. Any questions?
Any questions for Alex? And again, Alex, thank you for your work and dedication to the agency, and the best of luck to you in your new position.
Thank you very much. Appreciate it.
Ms. Nichols,
Morning.
good morning.
Feel bad giving you my report after Dr. Rupert. Oh. Well, yeah, it's exciting.
Do you want to make it rhyme? Or
Take a memo.
So a couple of painful disease updates from our regional LPs. We kind of already touched on respiratory virus season. Thankfully, those numbers are lower so far this year than they were last time around the same time. There were some detections of avian influenza in some backyard poultry. These were the first detections since March of 2023, but unfortunately there was a recent detection around December 8th for Montgomery County. So that is still on our radars and should be on people's radars for their crops. Let's see here. I don't know much about the respiratory virus in pets, but I did include a link just for public awareness there, if anybody would like to look more into that article. And then a couple of outbreaks going on in foodborne illness. Thankfully low numbers for that in Michigan, but fun fact, I did not know this, so I learned it in a recent foodborne class, but cantaloupes or melons are actually one of the #1 causes of foodborne illness. So make sure you scrub and wash your melons before digging into them.
You know, I knew there was a reason I didn't eat cantaloupe.
Yeah. Yeah, kind of crazy. But for immunizations, you know, of course, it's respiratory virus season, so we're definitely doing a lot of COVID and flu vaccines. We're still trying to go over the RSV vaccine and make sure that's a good fit for, you know, everybody's up to date on clinical considerations for that for 60 plus and pregnant women. So still going over that. And then our mobile unit RN has been out and about. She's done some vaccinations at assisted livings, long-term care. She's been to some jails. So she has been out working on getting people vaccinated that have reached out to us with needing some assistance with that. And then she's also working on training in the lead program. Our main lead nurse right now actually works in children's special health care. So we are training our mobile RN to be able to help with that program, especially since children's special health care is working on their age expansion and getting a lot more clients into the program. So our current lead nurse really needs to dedicate more time to that program training. In WIC, our WIC coordinator, she has been working to make sure we're prepared for our upcoming management evaluation. So that's basically our accreditation for the program. And we do have a date for that now. It'll be March 18th to 22nd for our, and they will review our Sturgis and Green Rivers locations. We had some corrective action, just some minor things from our last evaluations. We're required to go through and do audits to make sure that those things are corrected for our next evaluation. So Shelby's been working on that. And then in October, we started our new maternal child health grant. So we did get more pack and plays and this year safe sleep books from that grant. So if anybody needs a safe sleep environment for a child, we do have those available. For children's special health care, I already discussed, what they're working on for their age expansion. And then, lastly, in hearing and vision, we have a new tech, and she's now fully certified to do both hearing and vision. And that's all that I have for you, Michelle.
Thank you, Kelly. Any questions for Ms. Nichols? Hearing none, we will move on to Mr. Andrietti. Paul.
Good morning.
Good morning.
We had quite a few new restaurants and change of ownership. I have those listed in my report. As always, I'd just like to encourage everybody to support those new businesses. Really feel strongly that those are kind of bread butter for our communities. Those mom and pop type restaurants, especially, which most of these are. So I encourage you, if you get an opportunity, to support these new businesses. Well, in septics, the first 2 months of this fiscal year has seen a significant increase over last year's same time period. For most significantly, were well inspections over a 57% over the same time frame last year, and then overall on-site sewage services were up 37%. So that's a pretty significant increase. And of course, with those types of increases, that does affect service times. And we've had a couple. I've taken a couple calls where people are like, "Hey, what's going on?" And so, just wanted you to be aware of that. I don't know if that will continue throughout the fiscal year, but we're certainly off to a very fast start this year. There was some more PFAS testing done in St. Joe County. This time it was at the 3R recycling site. And if you don't, I'll just refresh you a little bit about that site. So back about 20 years, there was a fire at an old recycling site out there. And the fire was extinguished using the firefighting foam, which now we know has PFAS chemicals in it. So a couple of years ago, they started doing some testing of the wells out there. Haven't really found anything significant. This last round, they did 10 more samples. 9 of them were totally non-detect, which is great. There was one home that had very low level detections of PFAS chemicals, so low that at this point, they don't believe that we need to put in a filter at that house or do any other remediation actions there. But as with all of the sites that we have in our counties, we will continue to monitor those. We'll continue to sample those. If changes occur, we will react accordingly. Also wanted to report that we finally got our open position for clerk here in the cold water office. Lindsay Warner left us back in October. Kind of had a long, arduous interviewing process there. We got a candidate, and she's actually starting on Monday. But in that light, I'd just like to bring forth that we've had a lot of openings in environmental health over the past year, done a lot of interviewing, and it's very time consuming. And unfortunately, throughout that process, we missed out on at least 3 good candidates that declined our positions because we don't pay them. And some of the people that we lost because we don't pay enough. And I just want to share that with the board. With the loss of a clerk here in the Three Rivers or in the Coldwater office, it really makes us very inefficient. In order to cover that position, we have to have sanitarians and even a supervisor fill in those positions. So then they're not doing the work that they need to be doing. And so it's really not efficiently financially. We're sanitarians and the supervisor obviously make a lot more per hour than a clerk would make. So I guess that's just something that I wanted to bring forward. It's very difficult to attract qualified candidates. That was the other part of this whole interviewing and process that I've gone through over the past year, trying to fill positions for the type 2, for sanitarians, for clerks. Got lots of applications, but not very many that are really qualified. So we're not attracting the really good candidates. And then when we do, and we get somebody in here and we interview them, we've had several instances. Well, like, yeah, job sounds great, but I got a better offer. So for what that's worth, I wanted to share that with you. And the last thing I wanted to say is, how much I've appreciated working with Alex. He's going to be greatly missed. It's been a pleasure working with you, Alex, and I wish you the best of luck, and I hope you keep in touch. So with that, I'll open it up to any questions that anybody might have.
Well, again, Paul, number one, thanks for getting us those updated sheets, because, yeah, they weren't really matching with the food inspection. That was on,
They
were on page
so
20, but, I also appreciate you putting some of those changes in restaurants in there, because I found out about something that I hadn't known yet. So, appreciate that. The other thing is, want to make sure your agency or your department's heard from Wheatland Township. They're looking at buying some property and building a new township hall. But only want to put in a holding tank because, limited use on that, on the restroom there, and don't necessarily aren't gonna have enough acre to put in a full-blown septic system. They just want to put in like 1,000-gallon tank, make sure that that's allowable.
That really is not allowable according to our environmental health code. The only time that the code allows a holding tank to go in is in a situation where there's no other option.
And it's an existing structure.
And it's an existing structure, right? It's absolutely off the board for any new build. So we have approved some holding tanks. Those basically have been in existing homes, all of them on lake lots that are very small. They don't want anywhere else to go, and that's the only option that they have. So,
on that note, there are composting toilets available also, right?
pardon me?
Composting toilets available for a situation like that, and I know it's a little iffy here and there, but I know years ago, there were several that were,
Again, that the site you're talking about is a commercial site, and those would not be allowed on a commercial site. There have been a couple of those that have been approved on an individual basis over the years, but for residential homes only, not on a commercial property.
Okay.
and one more question.
Sure.
On your PFBS, in parentheses, you have 5.86 PPT. Is that parts per thousand?
Parts per trillion.
Parts per trillion. Okay.
Yes. Yeah, I could have wrote that out. I apologize. Yeah,
That's okay.
yeah, it's parts per trillion.
Want to make
So
sure.
really small numbers.
Thank you.
You bet.
Any other questions for Paul?
Thank you.
Thank you, sir. Moving forward, we were now on to item 6A, approval of payments, and I believe we have before us the payments for the month of October 2023 and November 2023. Am I correct on that?
Yes.
Yes, the agenda says approval of payments, so we will be looking at approval of payments for both months combined. So I will entertain a motion to approve those payments as presented.
So moved.
I have a motion by Commissioner Hoffman, support by Commissioner House to approve the payments for October and November 2023 as presented. Any discussion or questions on those? The only question I have is why do we have two Blue Cross Blue Shield commission payments on October 20th?
There was an issue with our billing. And so we did not pay one because they had billed us incorrectly with the renewal. when the renewal came through, the bill was incorrect. They asked us to hold off paying it until they could correct it, and then we paid, to it.
All right. Because I went back and I did not see a payment in September, and I'll just say that that's weird for Blue Cross to say, don't pay it. Let us correct it first, because generally they say, just pay what we billed you, and we'll get it corrected and adjusted in the future.
Just so you know, Blue Cross did not tell us not to pay it. Our Lighthouse, our insurance agent told us.
Okay. Any other questions on those payments? Hearing none, all those in favor of approving the payments as presented, say aye. Aye. All those opposed, motion carried. For 6B, review of financials. That's on page 47, and I believe this is just for the balance sheet for the month end of October 31, 2023, not November. So
Yes, we have not had a chance to complete November yet, still early in the month. So this is just through October. And through the month of October, we were 1.03% under budget. This time of year, we're still working on the original budget, which is a complete stab in the dark. So there are a lot of programs that you see on page 51 that are kind of a little bit out of range. We also get things that come due in October that cover the whole year. So there's nothing here that we're not, or that we are concerned about. We'll be making a number of changes in this budget amendment that happens later to bring us more in line with reality. So I'd be happy to answer any questions you have.
I'll entertain a motion to approve the month-end financials as of October 31, 2023 as presented.
You want that one, Jared? I'll do
And support.
I refuse.
Support. All right, we have a motion from Commissioner House, support from Commissioner Baker to approve the October 31 balance sheet and financial statement as presented. Any further questions for Teresa on this?
I have a couple questions. Program, I guess you call it program number 023, capital expenditure is 85,000. And to this date, nothing's been spent out of it. That might be.
Yes.
So you budgeted 85,000 for capital expenditures for the year 2023, right?
For the fiscal year that started October 1 of 2023.
Okay. Got it.
Different than the county. Your county budget is
Yeah.
one fiscal year.
Okay.
It can be.
Start October.
Yeah,
starts 10.
the health agency, because
Right.
the vast majority of our funding does not come from the counties, it comes from the state of Michigan and from the federal government. And so our fiscal year coincides with their fiscal year.
That explains it. Thank you.
Any other questions? Hearing none, all those in favor of approving the financial statements as presented, say aye. Aye. All those opposed, motion carried. Moving forward, committee reports, finance committee, item 7A, approval of the finance committee December 4th meeting minutes. I'll entertain a motion to approve those minutes as presented. So moved.
Support.
We have motion from Commissioner Hausmacher, support from Commissioner House to approve the finance committee meeting minutes as presented. Any discussion or comments on that meeting? I know many of those items will be discussed here in a little bit, but
It's a very nice meeting.
all those in favor of approving the finance committee meeting minutes, say aye.
Aye.
All those opposed, motion carried.
Jared did.
No, I didn't.
I saw it.
I saw it.
Just
It'll be his next. So.
Point that out.
Moving forward, item 7B, Program Policy and Fields Committee meeting minutes, and those are in our packet, and I will entertain a motion to approve those minutes as presented.
Make a motion to approve of PPC program policy field board minutes.
Do we have support? Motion by Commissioner Baker, second by Commissioner House to approve the Program Policy and Appeals Committee meeting minutes as presented. Any further discussion? And again, many of the things that were discussed there will be brought up in our agenda later on here. Any discussion? Hearing none. All those in favor say aye.
Aye.
All those opposed? Motion carried. All right. New business, item 8A, environmental health fee schedule. That's found on page 54 of our packet.
So as we discussed at the finance committee meeting, there is no proposal to increase fees as they are, but a request to capture the convenience fee when individuals use a credit card to make payment for a service. So, the portal system that we're trying to establish utilizes a credit card system that would charge us back for that convenience fee. Our attorney has advised us that we can, if you allow us to, charge that back and increase the fee to be able to collect that. So the actual convenience fee is exactly what the credit card company would charge us.
Based on their current fee schedule. If they adjust the fee schedule, we would need to adjust this accordingly.
Correct.
And from listening to that planning committee meeting, if somebody comes in here and pays,
They do not pay that extra fee. And if they use a credit card at the time of payment, we have another vendor who directly interacts with the client and will collect that directly from them, and we're out of it. So, just if they use the electronic.
the online portal application.
Yeah.
Process.
And all staff tells people all the time, you can pay with a credit card, but if there's gonna be an additional fee attached.
Right.
If you'd like to write us a check or come in and pay cash, you can avoid that, and most people do that.
But it's nice that they have that opportunity to have that convenience. You know, we have a lot of people that live out of state. They live in Illinois or in Indiana, and they have properties here in Michigan, and they gotta get something done. And instead of driving all the way up to Three Rivers or to Coldwater or to Hillsdale, they can do it electronically. So, you know, the fee is for a lot of people worth it to them. And, you know, this portal system is part of the new Hedgerow software system that we have been using. And so it's really a nice feature for clients, for, you know, especially for contractors that do a lot of stuff. You know, they have to take time out of their day to drive up to our office, or otherwise, you know, once we get the portal up and running, they can just go onto the portal and right from their desk at their office, they can apply for these permits, and then, you know, they could apply the extra fee onto their clients.
But let's be honest, that potentially allows your staff to be more efficient and their time as well.
That was gonna be my next point, exactly. It will free up our clerical staff quite a bit, having this portal system, so, you know, they're not having to get up out of their chair and come and stand at the counter and deal with folks. This will just come through electronically, and it will be much more efficient.
Does that portal allow an ACH transaction, Paul?
Checking.
Automatic?
It doesn't. It's strictly credit cards.
Okay,
There's always a fee. There's no way to avoid it.
okay. All right.
I know we accept the fees.
I support that.
Motion by Commissioner Hount, second by Commissioner Hoffmaster to accept the fee schedule as presented for the online portal application process. Because in essence, we're not changing the fee for somebody walks in the office.
No.
So,
No, not at all.
any further discussion? Hearing none, all those in favor say aye.
Aye.
All those opposed, motion carried. Next up is on our agenda, item 8B, Board of Health meeting, 2024 Board of Health meeting schedule. And I believe this was talked about at all of our committee meetings. Any additional questions or discussion?
There is one here on here. It says February 17th for Finance Committee. It's February 16th, like the 17th is a Saturday. I don't think you want to come see me on a Saturday.
We're doing it on a Friday that,
Yeah, the January and February are both moved to that Friday
Okay.
because of the holidays of Martin Luther King Day and President's
That's
Day.
right,
They're falling on the
I make a motion that we accept the board meeting minutes and committee minutes, or I'm sorry, schedule as presented,
2024.
2024.
I'll support you.
Motion by Commissioner Hoffmeister, second by Commissioner Baker to accept the 2024 Board of Health meeting schedule as presented. Any further discussion? Hearing none, all those in favor say aye.
Aye.
All those opposed? Motion carries. Okay, we are now going to go to the new item 8C, which is the wage increases. That's found on page 71 of our packet. Teresa, who wants to go? We have before us a request from the administration for a 10% increase to the Board of Health wage schedule.
So I talked in generalities, and Teresa is gonna take it from here.
Yeah, so you have before you a proposal to increase wages by 10%. And there is a lot of information here. We'll go over a few specific points. If you look back in history, we have to ask for such a large increase because we got behind by a long ways back in the early 2000s. So the agency received regular annual adjustments to the salary scale from 2000 to 2009. But in 2010, the agency was no longer able to provide those yearly adjustments to its scale. And that corresponds with the same time period when the health department received really, really big deep cuts from the counties and local appropriations. So from the years 2010 to 2019, the agency received 150-cent raise for everybody in 2013, 1% raise in 2018, and a 1% raise in 2019. This put the
Can you
employees.
give me those again, Teresa? I will pull out here.
That is on.
Yeah,
71.
okay.
Yeah, it's a second
Second
paragraph.
paragraph.
So that put us really far behind, and we were trying to figure out how to adjust for that. And that is why we ended up doing the wage study in 2019 with the independent contractor, so that we could do kind of a reset and get us back where we needed to be. But at that time, we weren't able to. We didn't have enough funding to make the full adjustment that was recommended. And we finally reached that full adjustment level last year after we did a 5% increase. So other health departments during this time frame when we were not receiving raises from 2010 or very minimal adjustments from 2010 to 2019. County employees for Branch Hillsdale and St. Joe counties were actually still receiving regular incremental rates. So the county's employees were still keeping up, but we were not, because we're not the county, right? We're sometimes treated as the county or equal to the county, but we're really not. So then when we received that recommended scale in 2019, we felt really good about that, and we appreciate all the work that the commissioners did to get us there. But that still leaves us today far behind because we're right now sitting at what was recommended in 19. And collectively, inflation over that time period has been 17.7% in years 21 through 23. And even the Social Security COLA increase is 17.8% for the last 3 years. So a 10% increase will bring us closer to the recommended adjustment for inflation. And it comparing it to other local health departments in an independent study that was done by the same contractor that did our study. They did a study for another health department in March. We received the data in May, which I shared with you. it would put us more in line with that. If we do the 10%, it puts us in the average, or pretty close to the average wage for other local health departments, where right now we are on the low side of that more often than any other health department that was studied. Also, Hillsdale County just passed an increase for their staff, and if we do this 10% increase, our level 2 clerical staff will be making comparable wages to what the Hillsdale County janitor makes. That's why it's hard for us to find people, right? Level 2 clerical staff will make $2.03 less than the Hillsdale County receptionist off the pay scale that the Hillsdale County just passed. So, it shows that even locally in government, we're still behind.
That's if we do the 10% increase.
It's with the 10% increase. And so, we need the increase to help retain and attract qualified staff. And we're going to pay for that increase through a combination of funding sources of the new ELP funds and some designated fund balance dollars from cost-based reimbursement and the community stabilization dollars that are in there. That we need to start spending down some of those dollars that are in the fund balance. That is our plan. And I would be happy to answer any questions that
We're talking total.
the total dollar amount for the increase.
Yeah, just the increase on, okay,
Right.
and Teresa, and I'll tell everybody, Teresa and I have had some conversation about this. I do not like the actual wage schedule that we have in front of us for a couple of reasons. And I went back and I looked at the report that Mr. Notley did here in 2019. If you look at Mr. Notley's report, his report in each grade had a 20% range from step 1 to step 7. Okay, and I'm going to call them steps. I'm not going to say higher in year 1, 2, 3, 4, 5, 6. Step 1 to step 7 was a 20% range. If you take that on an average year by year, it should be a 3.09% increase from step 1 to step 2, step 2 to step 3, step 3 to step 4, and all the way on up there. If you look at the wage schedule that's before us, it's not an even 3.9% across the board in each one of those lines. The other thing is between grade level 1 and 2 is a 12.5% wage increase. Between grades 2 to 8 is a 13% wage increase. And then between grade 8 and 9 is a 16% wage increase. All right. Teresa talked about the wage change that we did in Hillsdale, and ours is a little different than what we're looking at here. So whatever we do, I'm going to recommend that we make some changes and not actually use the schedule that's here, but make sure that that change from from step 1 to 2 is 3.9 all the way across. Okay, every year is 3.9%. Or 3.09, excuse me, 3.09. And then make sure that we're 13% increase between grades 1 and then all the way down, and then still use that 16% increase between grades 8 and 9. Those numbers, so the dollar figure that you're looking at there on a dollar per hour, when you do that, are going to change a little bit. But it standardizes everything across the board. And when you do that, then and you get everything into the formula, the only number you have to change is level 1, step 1. Because you apply 3.09% all the way across the board, and you get out to level set, that last grade, and 13% on down and all the way across.
And I wholeheartedly agree with Commissioner Leininger's assessment of the situation. The scale is a little bit wonky, and we've just been propagating that instead of adjusting it, we've just been keeping it the same. So I wholeheartedly agree with his comments. It needs to be corrected. And I have made those changes, but I did not bring them to you because that's not moving to the finance committee.
Yeah, well, once that happens, obviously all those people will be grandfathered in. It's not like when then we all of a sudden
Right. Yeah.
go from this is what
Right.
year 2 scale 4, if that changes, obviously we don't reduce pay for.
And with a 10% increase, any adjustments we're gonna make that are gonna be a few cents here or there, are not gonna matter. Nobody's gonna be left behind. It's just gonna clean it up. So to answer the question about the dollar amount for what this 10% will cost, adding 10% will cost $319,738 to the budget. And that is without the new positions. So if we add new positions, that number then would obviously change.
This is sustainable next 6 years.
Yes, I believe it is sustainable over the next 6 years. So right now we have solid funding for ELPHS. We have no reason to believe we're going to get a cut. We have this additional funding. It's expected to carry forward. The fund balance dollars, this increase would use approximately a little over $300,000 of fund balance dollars. We've got several $1 million sitting out there that's going to sustain us through that time period. Then once we get past it, by the time we get 6 years out, we're projected to have the underfunded pension plan no longer underfunded, which means we won't be making that big back payment that's $500,000, which we believe will cover the rest of this.
So just again, to reiterate, that 411, 468, we're planning on that continuing going.
What's the interest look like?
Right now, we're making crazy interest rates. They're astronomical. We can't expect to continue that.
That'd be nice.
It would be great if it was. We made much, much more interest last year than we ever expected to get. It's really much more than I've ever seen us get in interest.
So is there a clause or policy for the cost of living raise for the employees? Any place in here at all? So if we go to a 3.9% across the board,
Well,
how does that play in with the cost of living?
all right, so our current system, and forgive me, I didn't go and look at the personnel handbook on this, but somebody hires them, they go on what we call the higher rate. I labeled step 1. Okay, they're here a year, they move up to step 2. Is that an automatic increase to step 2, or is that based on a performance evaluation?
Automatic.
That's an automatic. Okay, so they're going to move up from step 1 to step 2. They get a 3.09% increase just on that. Okay.
And that's based on their experience and ability to do the job. They're better able to do the job because they've been here, they've been trained at that point.
And so, and Teresa said, well, the schedules over those last few years didn't see adjustments. But how many employees did we have that were redlined in that step 7?
Oh, there were a lot that have been redlined for quite a while. Not as many. We've had quite a few retirements lately, and COVID really took its toll earlier. But we still have quite a few people that are redlined.
Those would be the only ones that did not see a pay increase, obviously, because they didn't have anywhere else to go.
Right. Unless they moved up a grade.
Yeah.
Well, and actually they lost. So I was here. I was one of them. It cost more money for our insurance. Our insurance benefit was less than it had been previously. So our out-of-pocket costs for care, in addition to the payment we paid just to have insurance. So we were flatlined and we were paying more out of pocket for the benefit package we do have. So we were actually taking cuts to our overall income value.
And just to note, so if you look at, I did a Excel spreadsheet and I took that 3.09% across the, change from year to year. If you just compare that to what Teresa's got there for that level 1, there is some differences there in those wages. When you go across there, it's just because of the difference, the system that we currently have that last year is like a 2.88% increase. And so, averaging those up and making sure that it's even a 3.09% increase across the board, you're gonna see a little difference in that. They're pennies, here or there.
This is a much better system than what we have.
And I left the department or the job classification that goes in each out because I just, to me, right, that doesn't matter. To me, it's the grade and the step.
Well, if Teresa's happy and you're happy and you want to adopt a new system, you put a lot of work. I'm sure you're happy. Sure happy.
Well, but I'll come back to you, Commissioner. At the county level, yes, we bit off a big chunk this year because, it's been 20 years since we did even a job classification. And so we saw many movements in positions and jobs, some major movements, some very minuscule movements in wages. The schedule we got from Municipal Consulting, we applied a 3.7% increase to that for information in January of 24. And with that, we're going to see some employees that are only getting just over a 4% wage increase.
Right.
Okay. Remember at the county level, our revenue, the major driving factor in our revenue is property taxes. The most that property tax values can go up in a year is 5%. We saw that this year. We're going to see that next year. But the most, our driving force of revenue, the most that it can change is 5%. I understand, yes, the agency hasn't seen a major increase in their wage schedule. I'm not sure I can swallow a 10% lump sum change in that wage schedule.
Yeah, and I would say that, I guess.
And I don't know what St. George County's done. What's Branch County done for their employees this year for wage, or next year for wage increase?
We just give elected officials 5, but we gave 7.9 cost of inflation a year ago. They've all.
Seeing the agency, we gave 5% a year ago across the board. What did we do the year before that?
2% the year before that. But remember, that just takes us to what was recommended in 2019. And when you look at what happened since 2019, that's when the big inflation numbers hit.
Ultimately, I think to Teresa's point, so this agency is competing for talent with Hillsdale, St. Joseph County branch, and obviously other, private organizations. So if we are trying to get talented people to work in the agency, and even if we do a 10% increase, we're still at a competitive disadvantage, it's rough. So from my perspective, I do think that they've been underpaid for quite a while, open to ideas, obviously. But I also think that I would kind of to Commissioner Matthews' point earlier, I wish he was here, we have this fund balance. If we have an increase in funding of this 411 going forward, I'd rather it go to paying for resources that are benefiting our residents and our communities rather than just sit in a savings account. Okay? And I get it. You need a savings account. Every organization needs a rainy day. Feels like we have a pretty good one. That's why I would be more in favor of going through the process of doing the 10%. It sounds huge when you say, hey, everybody in the agency got a 10% increase, but in real terms, we're still underpaying the employees compared to other organizations that they're competing with.
Teresa, do you have any numbers as to what let's say a 7% increase would cost the agency?
Yeah.
On that.
So 7% increase by 7% without adding new staff would be $223,816. So almost 100,000 less.
And I asked that because that whole wage study in the 3.7% increase in Pittsburgh County, just that cost the county next year about $384,000 in our general fund. Yeah, and now we're going to be competing against Myers coming in and wants to hire 320 employees. So right, yeah. So
it's a pickle.
Our department's taken on the chin for a lot of years. I'm in Wiltshire. I think 10% reasonable. Gets it back into fighting game. Additional funding coming in, Teresa's been playing on the books for a couple of years, put us in a good situation. Mid scale and a 10% rate.
How far off do you think we're gonna be from what this year's wage study would be with a 10% increase?
So.
To
when
get
we
us
look-
to this year's date, not 2019.
Right, so the study that was done by Municipal Consulting in March of this year surveyed 15 health departments. And this would put us, if we do the 10%, the last column here on your page 101 showed you how we stack up to the average.
That's page 73.
Oh, sorry.
73 of 101. This page, Rusty?
Would you say it again, Teresa? I'm sorry. I was looking at you.
So this last column here shows you how we stack up to the average of those surveyed in May of this year. And, you know, this is going to obviously change because most agencies try to do a cost of living. So we're looking at, this will put us a little bit under on the low end of the scale, pretty close to average on the higher end of the scale for 23 wages. What's happening this year? So it puts us right in line. 10% puts us right in line with the average of those that were surveyed this year, just a little bit under that.
Some of these will be way over though.
Well, in the last 4 years, if you'd have done a 2% increase every year for the last 4 years, wouldn't be anywhere near 10% right now. Right? You know what I'm saying?
Well, it's a compounded 2%.
Yeah.
You're getting close to 10%.
Right. Right.
Compounded 2%, you know, 2%, you know, you're
A
not,
lot closer right now.
Yeah, we would.
There's just some more numbers. I mean, where did we pull these from? Did we pull them from Grand Rapids? We pulled them from Detroit? Where did that?
well, I mean,
Probably
if you look at and I don't remember if the
They
report,
weren't big.
I don't remember if the report that Mr. Notley did for us here, yeah, he had it in there where he got his comparables from.
Yep, I can tell you. Just take me a minute to pull it up.
I've got it right here on paper, Teresa.
Oh, okay.
So if I can find it here.
That's our study from 19.
This is your study.
What about the study from 23?
Okay, I'm gonna look at the study for 23.
See, a couple ones.
Yeah, I sent it out to you guys.
I thought we saw it in the finance meeting.
Yeah, I remember seeing it. It's not compared to the big inner city.
Commissioner Leiniger, do you mind if I make a motion? So
I don't know.
I make a motion that we pass the action item giving the agency a 10% increase in wages
with the adjusted scale.
with the adjusted scale.
The
That
scale?
Commissioner Leiniger presented. Does that sound good? Will you clean that up for me, please, Teresa?
I will.
We have a motion from Commissioner Hoffmaster, support from Commissioner House to apply the 10% wage adjustment to the agency pay scale and to standardize that schedule with a 2.09% increase between steps, a 13% increase between level 1 to 8, and a 16% increase between levels 8 and 9.
I said that?
You said that.
Oh, wow. Yeah, I like that. I like that. That sounds good.
Any further discussion on the matter?
Yeah, my problem with this is, I mean, we got people from, from the wage study that's done as comps that are only 4% under. We got others that are 20% under. How's that gonna help us get you guys that are 20.88% under the wage? You're still gonna be 10% under.
Yeah, it doesn't balance out.
It doesn't balance out.
You know, the only way to potentially look at that is to potentially, look at regrading those positions. Should that environmental health clerk be regraded, and should that still be a grade 1 position, or should that be moved to a grade 2 position?
I mean, not to pick on anybody, but we got, you know, down here grade 7 sanitarian, they're already you know, almost 1% over everybody else, they'll be 10% over.
No, that's
with the.
that's with the 10% adjustment.
Right. And then we go up here, and we still got these guys, these poor guys up here, line 2, they're 20.88% under.
That's probably due to how they are graded at those local health departments. In other words, they took a look at the job description and they figured out based on the job description where they fit. And everybody does this with Mr. Notley when he does this consulting work. So either our job description is just flat out graded wrong. I don't think so. Or our job duties are different in that category than what they are at other departments.
And some of these jobs don't really line up exactly.
You know, and that's the problem. Our agency says, well, this person does this. This agency says, well, they do that. Well, he has to try and mesh those and put together an average and say, well, based on what I've got, these are the comparables to the position that you have.
Right. So for example, in some agencies, they have a director of finance, they have a director of HR. In this agency, that's me. I'm both those people. So we don't necessarily do the same thing, even though the job title, or they're kind of lumped together. It's hard. So the health departments that were took place in the study from this year were Barry Eaton, Berrien, Branch Hillsdale St. Joe, Calhoun, Central Michigan District Health Department number 10, Grand Traverse Health Department of Northwest Michigan, Ingham County, Jackson County, Kalamazoo County, Kent County, Mid-Michigan District, Monroe County, Muskegon, and Ottawa, and Cass and Van Buren.
So we've got a broad
Yeah.
aspect
Kent County,
of
Kalamazoo County.
So my problem with all this is this is putting every employee in a shoebox. This is a one size fits all. And to your point, there are people that are above and people that are below. So in order to put everybody in the same shoebox, when was the last time we had an employee evaluation as far as seniority, where their wages at, where their duties are at, and where their qualifications are at? And if we went through and brought everybody to a appropriate point to some degree, and then go to this, I would be in favor of that. But when we put everybody in the same shoebox, and some people have been here 10 years, some people have been here 2 years, is it fair to do the same to everyone across the board? And I know there were some disgruntled employees at our county for doing just that. And I heard some feedback on that. So to put everybody in the same shoebox and treat them all the same and do a 0.9% between steps, what have we done to them to this point as far as their seniority, qualifications, and duties?
That's what we didn't, yeah.
And that has all changed. So do we need to maybe look at that before we go into this shoebox?
Well, we're already in the shoebox,
Yeah.
Commissioner, because we already have a wage schedule. It's just,
It's antiquated.
well,
It's not,
it's not antiquated. It's just some of those, the percentage between steps, they're not standardized across the board. There's one that's 3.3, one that's
Yeah, I get that.
okay.
I get that.
So we already, and in 2019, the agency didn't implement the full wage schedule, but they at least implemented the grade schedule that Mr. Notley in Municipal Consulting presented to the agency. So he came in and he did that grading of
Right.
the agency employees, and the agency said, okay, we're gonna take the grade, and the environmental health assistant clerk's gonna be a level 1. These other people are gonna be level 2, these are gonna be level 3, 4, 5, 6, 7, 8, and 9. All right? But then the agency said, but we're gonna use this for a wage scale for those positions. And if you are a new hire, well, this year you're gonna get this rate, and then next year you're gonna go to step 1, and then, or you're gonna move up every year on through there. So we're already doing that.
Well, I agree with that here, but maybe we need to reevaluate each of these lines that are way under If we're gonna go with Mr. Now,
Policies we can do next year, but we're here today.
We can absolutely review those
Yes.
again, but we did in 2019.
And-
And in 2019, that job matched right up with the ones that are also level.
my point is, if we're gonna go up, Mr. Nosley saying that we're paying so much below, our jobs don't line up with that schedule, then that doesn't really, this data's flawed.
Yeah. The other thing that, and, you know, talking wage schedule, and the other thing that we did in Hillsdale County is we said, we're gonna standardize the movement between steps. And everybody's gonna move step January 1. Doesn't matter when you hire in, we're changing from an anniversary date of step to a January 1 date of steps. That simplifies budgeting 1,000%. Okay, here at the agency, we have people move steps every month
Oh, every year.
or every week,
Mhm.
okay, in a pay period. Think of the accounting nightmare that is.
Yeah.
So that's something that we talked a little bit about at the Program Policy and Appeals Committee meeting. Do we need to look at coming in and starting in the next fiscal year and saying, you know, everybody's gonna change steps beginning of the fiscal year? Which would be October 1.
If someone comes in December, they get a bump, someone who got hired in January, they have to wait about that.
Okay, well, so what we're doing in Hillsdale is somebody that hires in the,
Everybody wants,
somebody hires in, right, we don't have to do it, but just looking at it, somebody hires in the first 6 months of the year, they move a step at the next year. But that doesn't account for if we adjust any year, if we adjust that pay grade a percent or two as well, they would get those increased.
I call
We have a motion to apply a 10% wage increase for the agency staff. We will do a roll call vote.
Commissioner House?
it. So me,
Yes.
yes.
Commissioner Hoffmaster?
Yes.
Commissioner Leininger?
No.
Commissioner Baker?
No,
Commissioner Lanius?
no.
Fails.
Motion fails 2-3. Where do we go from here?
You're the one that changed your mother.
Well, again, I would move that we apply a 7% wage increase across the board with the standardized steps.
I move to increase our wages by 7% with everything else that Brent said in the beginning.
Are you gonna say that all over?
I'm- With the new wage, with the new.
I've got it.
I was gonna say, I have it too. Because that's what we discussed.
Which line's your? Number. Administrative Service Director, that's.
Is this 7%?
This is 7%. And mine may be a little bit different, Teresa, I don't know. I think our rounding in that first number at times is off a little bit. Okay, 13, 30, 50, yep, here, John.
Like you said, you know, I mean, you're picking on, 2 or 3 halves more than what the normal person's doing
Yeah.
that way. You're still 15%. I just
Be closer if we gave a 10% increase.
sure would. Well, you're over what the average is. I just don't think it's fair to the Teresa world.
Sure, she's not worried about that.
Well, 10% is better than what I have today. So I'm closer than I was. Or 7%. And to be fair, when Mr. Notley was here, he indicated that my particular job should have its own thing, but we didn't want to add another thing. So we knew that going into it, that my job has got more responsibility than others in its level.
So you're wearing 2 hats, right?
Oh, absolutely.
And I'm just, if you look at what Teresa,
So could your position be reevaluated completely and brought to a different level, or?
There's no place else for it to go unless we add on to it. So,
We're here
and we
talking
knew that,
And
so it's fine.
not job description.
Yeah.
And I got a meeting here. Wow. And we got,
I need support on my motion.
I'm looking forward to have all that.
Thank you. I appreciate that, Jim.
Motion by Commissioner Hoffmeister, support by Commissioner House to apply a 7% wage increase. That would be a cost of $223,816 to the agency.
Slightly different because that number came from the scale before it was uniform.
Yeah, I don't know, Teresa, down here. And again, it could be just how my system is set up for round. We're off a few pennies on some of those numbers. What I had was to, we ended a penny short in the last year, so. But yeah. What we've got here that Teresa handed us is, I think is adequate. Any further discussion on the 7%? Hearing none, roll call.
Commissioner House,
Yes.
Commissioner Hoffmaster.
Yes.
Commissioner Leininger.
Yes.
Commissioner Baker,
Yes.
Commissioner Lanius.
Yes.
Thank you.
Okay. That is 7%. Now,
Thank you. I'm for the employees. I'm very grateful.
and again, I said it. In a government position, it's hard to across the board apply a 10% wage increase at any one time.
I understand.
I added agenda item D, the new employees. I do want to discuss these individually. So, I believe there are, for new employee positions, we have multiple on that. There would be
What page is that on?
it wasn't, we go back to Becky's report.
Okay, gotcha. Yes. Okay.
So the first two are an EH supervisor as recommended during our accreditation audit for our general programming. And an EH sanitarian, as we are staffed below the recommended FTEs for those programs. Nursing was 1.5 FTEs. And adding a human resource support person to our administrative services.
To help Teresa out with her hat wear.
That's great. And recognition of that.
So EH supervisor, EH sanitarian, 1.5 nursing, and human resource.
So bring her closer along.
Okay. So the EH supervisor, that I believe will be a level.
Level 8.
And the rate on that now at the higher rate. I just shuffled that around. Yeah, it'll be just 31.29. Yeah, 31.30. If we use, be 31.30. Just rounding a little different. I'm gonna take this one that Teresa's got, 31.30 to, so the annual cost on that.
For the year one annual cost.
$61,035. And that does not include benefits. That's strictly wages.
EH sanitarian.
$47,794.50.
And the nurses are level 7.
So as we're working numbers, all of these additional positions were included in the budget amendment that was before you today.
So $54,015. And if you want the total number for the new staff, including benefits, total cover with a 7% increase, including benefits, it would be $307 or $307,042. That's 7% on the difference. Might be slightly off because that's figured on the old 7% scale, not this new adjusted.
Rebecca shared at the finance committee meeting that she kind of came into this position as director and unfortunately had to go through the process of laying off employees. So I would assume that, you know, with that in mind, being able to take on these new employees and that experience hopefully has led to you understanding that it's a big deal to hire, obviously, and it's a big deal to lay off. So this isn't a 2 or 3 year thing. It's a long-term thing that we think that we can sustain moving forward.
Right. Thank you.
Yep.
Well, unfortunately, Commissioner, I'm not sold on the idea that this increased environmental health money is going to be there. You know, the legislature is a finical body. It changes. You know, every 2 years it changes, or this year, you know, it may change in March of next year. So, and, you know, the state legislature this last year spent a lot of one-time money that they had. That one-time money is gone.
Yeah. We're only as good as the information we have currently, unfortunately.
Yeah. And obviously, if they cut it, move it, that's a moving scale. But we gotta get the agency up and running properly.
And use the resources that were being provided to benefit our residents, our community. You know,
Yep.
again,
Healthy fund balance because they were scared of the one's gonna be taken away from us. It happened.
And we just authorized new software to help the agency's clerical duties. Across the board, right?
For EH. Yeah. So it's only 3 people, but yes, absolutely.
I make a motion that we give the health agency the authority to make the hires that are presented.
We have a motion by Commissioner Hoffmeister, support by Commissioner House to approve the agency health officer to post and hire the positions as presented. Be an environmental health supervisor, an environmental health sanitarian, 1.5 nurses, and an HR community resource assistant.
Staff.
Support personnel, yeah. Seems the most appropriate term.
Any additional comments? I will say the reason I wanted this added as a separate line item, and Becky, it comes from your job description number 4. Make recommendations to the Board of Health for budget, staffing levels, and increased efficiency. So that's why, to me, I think it needs to be a separate voted item, not just included in the budget.
Okay, so when you hire someone and you come in and they do an interview for a position, how do you determine what step you're gonna start them on,
Everybody starts at step 1.
regardless of their qualifications?
Yes.
Well, you have authority to.
Well,
So there, I'm gonna say therein is a problem for hiring. Because you get someone that's qualified to be at step 5, and you wanna start them at step 1, they're gonna walk out the door.
and they do all the time.
So that's not a solution to our hiring problem.
They'll do that.
No, I don't think they do that, do they?
Yes, they come into step 1.
Step 1.
Okay, the issue, Commissioner, is especially when it comes to budgeting, you build a budget, and if the position's open, it's budgeted based on bringing people in at the higher rate, and then advancing over the years. Also within the agency, our personnel handbook, and we're gonna talk about that next, has language in the personnel handbook that if you move from grade up, you go to the step nearest above
Where you're at.
where you're currently at. Okay,
This is what branch got, we allow new hires to go to the step 2. But they don't get the pay increases for 2 more years, but they can start us.
Yeah.
Seniority and this pay scale says, but to entice people to get a little higher wages, we do allow that.
Well, where I come from, you're hiring an apprentice instead of a journeyman.
You're trying.
and if the
We're
government,
competing against private sector here.
Absolutely.
no, but no, for some of this, for the most part, in the environmental health sanitarian, those are primarily governmental positions.
We're flexible. Might not be so in private. There are advantages to coming to the health department. I want to go watch my kids' Christmas program. We're gonna let you go. You may not get to do that in private. You know, we have
But-
nice vacation and sick time policies. You may not get that in private. When a
37
nurse
and
comes here, they come here because of that. They don't come here because of what we pay them. I can guarantee you that.
right, they're coming here because they're not having forced overtime. Here they work 37 and a half hours a week.
Work-life balance.
On the motion.
We have a motion before us to approve the
Yeah.
4.5 positions as presented.
Want to see that half position.
I will do a roll call on this as well.
Commissioner Houts,
Yes.
Commissioner Hoffmaster.
Yes.
Commissioner Leininger,
No,
Commissioner Baker,
Yeah.
Commissioner Lanius.
no. Motion passes 3-2. Next up, and we just talked about this, is the environmental health supervisor wage. As you'll notice in the wage levels that Teresa gave us, that environmental health supervisor classification is in there as a level 8. I do believe they have an internal candidate who is an environmental health sanitarian,
Senior secretary.
senior sanitarian,
Level 7.
level 7. Where are the other sanitarians at? Level 6.
6.
Okay. And if you look at this step schedule, everywhere in there, and he is what, level, and I'm gonna say it step 6.
Step-
He's step 5.
Okay, she got base, and I would, and yeah. Step 1, 2, 3, 4, 5, 6, 7, he's step 6. And if you look at that all the way down through there, what Teresa has labeled as step 5. So this is where he has, he's moving from a level 7 to a level 8. He's currently in that 30, with the increased pay, he would make $32.25 an hour. Okay. If he increases to the job position, it's $32.27 an hour. What's he currently making? 30? No. I've got it, it's on the current wage schedule, right? 30. No, it's not in there.
It was a 2 cent per hour. That's,
Yeah.
I can tell you.
But it's, okay. But our personnel, and I believe the planning committee said to approve him moving to the step 3. I'll tell you, that's in direct contradiction to our personnel policy.
So that staff member has sent me an email requesting that this be looked at and that he be afforded to go to not the 2 cent level, but the level above it, which would give him a 99 cent per hour increase as opposed to a 2.
But he's already getting the 7% increase as well.
Yeah, but so is the other sanitarian that's at the same step.
And the rest of the employees.
Well, but
He'd
here,
be the only one.
and this is the thing that a lot of our longtime employees in Hillsdale County didn't realize when we instituted this new wage schedule, and some of them didn't go to that far right, that last grade. When you move up a grade and you drop back in steps, he has the built-in 3.09% increase over the next future 5 years.
I agree. I do agree.
If he doesn't take that and he moves to the, and again, you're going to see this. If you look at that column for every classification, and you come down and you look at the next level, level 1, level 2, 1549, 1550, level 2 to level 3, 1751, 1750. They're equal. It's just the way this schedule is built with that 20% spread across the grade. You're going to see that pretty much in every one of those level changes. But that's the policy that we have. To me, have we had this ever happen in the past where somebody's moved and they were in that column and they to the next grade? What did we do?
I can't think of an example for you because there are almost no opportunities for this to occur. All the supervisors that we've recently hired have come from outside.
No, but I'm just saying, anybody else on any other level that was in that, I'm gonna call step 6, did they move up a grade? And where did they go?
Yeah, so this same sanitarian went from a general to a senior sanitarian, and at the time, he received a 12% increase at that time.
With the understanding that he's gonna increase his pay 3.09% every year.
Where he's
Further.
topped out after next year.
If he doesn't move, he's topped out next
Right.
year.
The difference
Exactly.
between the jump from sanitarian to senior sanitarian is there's really not any more duties. It's a matter of getting your certificate as a registered sanitarian.
Well, he
So
does
you're
have-
rewarding them for that.
he could do land commissions and things that
You can do a few more things, but the jump from a senior sanitarian to a supervisor brings a whole lot more responsibilities to that job. And, to go, okay, I'm gonna take all this more responsibility for 2 cents an hour. There'll be someone who wants to do that.
But it's not. I mean, if we're being honest, it's not just 2 cents an hour. I mean, I get what you're saying, Paul, but I understand what Commissioner Liner is saying too. You have the ability to make more money now. That should be a pretty good incentive. Now you're not going to be capped out at the next step. You're going to have 5 more steps that you're going to be able to compound over, and maybe he keeps on moving up. So, I mean, I don't necessarily, I understand what you're saying. And from his perspective, he's like, I'm only getting 2 cents an hour more from this. But if you're going to take that position, you have the more long-term goal in mind as well. From my perspective.
For sure.
So he did request this, we're bringing it to you today with that ask, and so I don't know if there was ever a motion.
There wasn't. I mean, we can have a motion to accept or
We're just gonna stay with the house.
Yeah, we don't even really have to.
No.
Stick with policy.
okay. Now the budget amendment, and I know our 7% changes some of that. So I don't know what we want to do now.
We can leave $100,000.
But the numbers are going to be different.
I mean, they are gonna be different because the budget that we're presented here, included a 10% increase. But I would still move this whole budget forward, because we'll make a final budget amendment in May. So this, brings us more in line with understanding that, it is obviously not gonna be completely accurate. It's gonna be more accurate than the budget that's currently working on. So I would move I would recommend that we still move this forward. But if you would like to wait until January to move a budget forward, we could still do that and meet our deadline here at the state. If you'd rather us.
When is the deadline with the state?
Well, we did have those amendments for the increase in funding, but I have to have submitted this week, and then, but the deadline is January 20th, somewhere in there, but I have to request.
Well, so when we talk about the next, one of the items down, do we call a special Board of Health meeting for December 27th?
I don't understand. I mean, so we're not gonna use all the money around, but
We would just operate on their budget.
they call it.
So we accept the budget with a 7% increase. That's
important.
We have the motion to accept the budget as presented with the 7% wage, with the 7% wage increase that has been approved. Any further discussion?
No.
Carry none. Please. Yeah, roll call, please, Teresa.
Commissioner House. Commissioner Hoffmaster,
Yes, ma'am.
Commissioner Leininger.
Yeah.
Commissioner Baker,
Yes.
Commissioner Lanius.
Yes.
Thank you.
job, 545.
Okay. Next up, under G, Board of Health bylaws, page 74 of our packet. Now these, we are not voting for these today, Commissioner, just they are here. We can't vote on them because our bylaws require a 10-day notice prior to any amendments to those bylaws, so this will come back before us at our January meeting. But in reviewing the bylaws, there was a couple of things that we noted that potentially need to be changed in our bylaws. If you look on page 75, underneath meeting, special meeting, just a clarification there that it's the board chair that will call a special meeting, whether it's a meeting of the board or a meeting of a committee. Okay. And then the other one is Article 10 that deals with county appropriations. And this is going to also be discussed in the next item that we talk about. Our bylaws deal with how we operate as a board. And that line item, in essence, is telling the authorizing counties how they're going to pay us. And our bylaws can't tell the authorizing counties how and when they're going to pay us. That needs to be in the operating agreement that's agreed to by the three counties that agreed to set up this agency. So the Program Policy and Appeals Committee is going to be recommending at our January meeting that we remove that Article 10 from our bylaws.
Makes sense.
Okay. Any other questions?
Is this in our operational agreement currently?
No, we'll talk about that in a minute.
Okay, sorry. Hate to jump the shark here.
It is not. So now we're going to go to the intergovernmental agreement, which is on page 86 of our agenda. And no, Jared, your question on that, that is not in the intergovernmental agreement that was last approved on December 13th, 2012. Okay. As we talked about at the Program Policy and Appeals Committee, we think that it could be added to that agreement. All right. There's also something that we as the board need to have a discussion about, and that's on page 3 of 10 of that intergovernmental agreement, and it's number 8, page 88, underneath term of board membership. When the intergovernmental agreement was adopted, it's defined that membership from each county board commissioners are appointed to this agency on a 2-year term of office. So you're appointed from your individual counties on a 2-year appointment that coincides with our terms of office as county commissioner.
Yeah.
All right. The question being is on January 1st, 2025, that term of office for county commissioner changes to a 4-year term. And so do we want and again, the language here is specific that it, appoint the respective board of commissioners for two-year terms running from January, commensurate with board of commissioners terms. Okay, well, again, we're not, that come January
We are
2025, huh?
We are for next year.
It-
25, we just do it.
But here's the issue, John, on this intergovernmental agreement. The intergovernmental agreement, and Becky has reached out to Andrew Brege, our legal counsel. If you'll notice, I think it's in here, towards the end of this intergovernmental agreement then has to be sent to the governor and to the State Department of
Yeah, the
Health Department
director of BHHS.
for approval.
That's why it hasn't been updated since 2012, probably, right?
Correct.
It's a big deal.
Okay, now, to be honest, Andrew's not sure if just minor tweaks like that have to go and get approval. But, we don't want to be that test case that says, well, you should have and you didn't. But again, anytime this is changed, we as this board cannot approve this change. So if we're going to suggest recommended changes to this document, we as a board have to be strong in our conviction of those changes as we go back to our local respective boards of commissioners and say, don't be messing with anything else in this, because then that has to be approved by all three counties. Just approve what the Board of Health is recommending change and keep it to that.
So moving from 2 years to 4 years.
Or
That,
or
Get rid of
I would
Or you have-
recommend just leaving that alone, because, going to a 4-year term, the county commissioner might the county commissioners themselves might want to change just a particular commissioner in their duties during the 4-year term, so it still falls within a 2-year period.
the issue though, Commissioner, is,
the
as I said,
commiserate with the board of commissioners term.
your term of office here commiserates with your term of office as the county commissioner.
Put that word in.
well, we're appointed annually by the chair.
Right.
Yeah,
So-
we are only innovation meeting.
Well, again, so, but this body, legally, your county has to make a 2-year appointment to this body,
As agreed upon.
as agreed upon by the county
Back in 2000.
back in 2012.
And
So your appointment here, right,
people just forget, right? They change and they forget.
personally kind of cleaning it up if that's what we want to do. I mean, you guys are gonna have to go through the process. We're gonna have to go back to our own boards, but that would be a fairly easy, I think, if we're doing.
Our board doesn't really care.
Yeah, I don't think ours
That's
does
where we're
either.
at.
So
Yeah.
is this the only change that would be made, is it's from a 2-year to a 4-year?
the other thing is,
Why don't we leave it, go get rid of them?
the commissioner, and again, I bring this up just as information, the Program Policy and Appeals Committee needs to work on this and bring back a recommendation. The other thing is dealing with that payment of those county appropriations.
Yeah.
It's not spelled out in here anywhere.
Yeah.
Okay,
Let's put that in there as well.
to put that in there to say, Range County, you just can't make that appropriation on December 31st. We need that spread out in equal installments over the calendar year and do the same thing for all three counties.
Is that an issue right now, guys, or is that what's happening essentially? Teresa?
It's not been a big issue. We have had payments that have lagged. But because we had a good balance, it hasn't really affected us in person.
But it would bring more definition and clarity.
If we're gonna
Clear
take
it all
it,
up,
we're
right?
gonna change it, we might as well get what we want in.
Yeah,
So then I will bring Andy's comments to the program policy and
And Appeals
committee in January.
Yeah,
and
and we'll work on that.
Very
Sounds like a plan.
Like it.
Give them something to do.
Mm-hmm.
All
I'll
right,
bring it to the finance committee.
that comes back then to the AAA Advisory Committee bylaws. Those are on page 77 of our
Oh, boy.
packet.
anything else with that?
I already went past it.
I got it back. Oh,
Get the paper.
And again, these were forwarded from the Program Policy and Appeals Committee,
77.
page 77.
Got it.
Oh, look at that. Found it.
Yes, and
Phone blue writing.
there's blue language on there.
77.
So.
I will also say that there was some discussion about these at that committee meeting. And I'll tell you right now, I will not be voting to approve them as presented.
Okay. So noted.
Can you tell us what we're wanting to do and then we can?
Yeah.
Well, it was recommended for approval. Laura, if you wanna talk about this a little bit?
Sure, the background on the changes that are proposed are a result of the state Bureau, the Aging, Community Living and Supports Bureau, putting together a comprehensive work group on anytime an operating standard, whether that's for a service program or for us as an area agency to adhere to and follow, are changed. They have a standards review process. So they look at current law, they look at current practice, they examine everything. And they've made some proposed changes and it went through the commission at the end of November. So the Michigan Commission on Services to the Aging updated this operating standard for our advisory committees to be run throughout the state of Michigan. It did update a couple of key areas in terms of how we meet. We are no longer, based on the newly approved operating standards, required to operate under the Open Meetings Act. So that also gives latitude to meet in person, virtual, via telephone, or hybrid approach. So that was updated in the proposed bylaws that are before you because, again, the previous bylaws, complied with the former operating standard. So that, that has been proposed to be changed, as well as how the committee is comprised. So the membership, we added language, again, based in Public Act, commission approval, and then the statewide review process to include, recruiting individuals of color, LGBTQ+, people with disabilities, older adults, a number of groups that have part of our targeting strategy. We always want to reach out to individuals who may hesitate seeking services, employment with us. So it would be a policy change to reflect that language that, again, based in law.
So how does that work practically though? Like, so we're going out there and saying, hey, if you fit this category, we want you to be on our board. Like, I guess practically, how does that work?
Sure. We are always open to, and want to represent all populations that live in our planning and service area. So it would be a matter of a part of our strategy, which is kind of in play already, to recruit additional members. We would maybe seek through an announcement in the Facebook community, for example, or in a primarily, Black neighborhood, or at a community center that serves lunch on Wednesdays to, XYZ, faith or other cultural group. So it just gives a nod to the federal and state, law that were just incorporated into the language that the commission approved. And again, the other changes were just sort of formatting.
The only thing I don't like about it is we can't fill a position now. So now we're gonna pay special attention to this group over here, or this group over here. We're all created equal, right?
I mean, why do we have to call those groups out?
Right.
And again, it's that paragraph on page 3 that I cannot support the language as presented.
And we can't fill them now, but we're gonna.
But any changes to this would have to go back to the advisory council for approval first, prior to us adopting.
Well, they don't set policy, the Board of Health does. So they've reviewed this and are supportive of it as presented. If the board chooses not to incorporate that language, that's up to the Board of Health as the policy making. The advisory council just serves in an advisory capacity.
So we can essentially approve it, cutting that language out. Is that what we're saying?
Make a motion, we approve the, AAA advisories, bylaws, moving,
Page 3.
yeah,
Committee.
start page 3 of 6, second paragraph.
So strike that entire paragraph.
It starts with further and ends with area.
Mm-hmm.
Do we have support?
Support.
We have a motion and support to approve the AAA Area Agents on Aging Advisory Council bylaws with the removal of the second paragraph on page 3. Any further discussion? I will say with that removal, I can now support it. Look at you.
Well,
Hearing no discussion, all those in favor, say aye.
Aye.
Aye. All those opposed, motion carried. That brings us back to item 9 on our agenda, public comment. We will open the podium again to any public that have anything that they desire to say. Yeah, please come to the podium.
You guys kind of did a lot of talking in circles when it came to the wage discussion. I know a lot of employees would get confused by that. I just wanted actual reasoning why we went from 10 to 7%.
The Board of Health does not make comment during public comment.
Thanks.
This is the time for the public to address the board
3 minutes or less.
in 3 minutes or less. Yes,
You wanna give the whole speech?
Without cursing.
no.
I'll just use my 3 minutes to say, in the Older Americans Act, it does lay out that the advisory council could have minority inclusion. It's also laid out in several other areas throughout Older Americans Act, Older Michiganians Act, that we look for minorities, non-English speaking groups. So the commission is very interested in seeing those targeted, but those populations targeted, but also represented in committees and councils that our sole purpose is to support services going to those industries. So that is where the standards come from. It's following the guidance from Commission on Services to the Aging, who is appointed by the Executive Office, Older Americans Act, and the Older Michiganians Act. So I just wanted to add that in. So the advisory council, I do an assessment with the AAA each year. I look at not do you check all these boxes, it's what are you doing to recruit. So I understand you need to fill seats, but at the same time, if efforts can be made to fill those seats that are looking at those specific groups, that is what we're looking for. Thank you.
Any other public comment? Hearing none. Is that a go? Make a motion to adjourn. Second. Have a motion by Commissioner Lania, second by Commissioner Becker to adjourn. All those in favor say aye.
Aye.
All those opposed,
Aye.
motion carried. We are adjourned.